June is Men's Health Month, and here's a stat that might surprise you. More than a third of men skipped or delayed preventative care just in this last year. And this morning, we're joined by Dr. Ben Blackmer from the Holland Hospital to talk about why that's a problem and, more importantly, how you can fix that. I think we can all understand why that's a problem, skipping the doctor's visits.
Most
how
definitely.
do we prevent that? I mean,
Yeah.
what's the thing here? What do we do?
So I think a big part of it first is just getting the word out there that this is a need, and that, you know, our male community as a whole don't often want to be able to ask for help and don't want to come to somebody that they don't have a good relationship to. And so it's important to be able to build that relationship, to be able to make sure that you can kind of strike that up and be able to review the concerns and worries that a provider might have with that patient, and make sure that their screenings are all up to date, looking out for colon cancer screenings and things of that nature, blood work, making sure that's all up to date, and be able to be there to answer any questions that they might have.
Yeah, you know, you kind of touched on it. Why do you think men do skip out on those visits, though? Do you think it's just we're men and we think we're too tough? Is that what it is?
I think that's part of it as a whole. You know, just society makes it say that we don't want to be able to ask for help. We don't want to be weak and things of that nature. And unfortunately, that's something that we need to be able to change because the providers, we are here to be able to be that resource for that patient and be their advocate.
Yeah.
Absolutely. We've heard multiple times on this show talking about the stigma behind men asking for help. For the men that we all have in our lives, or for anybody watching at home right now, what do you think are some ways that we can encourage making sure to ask for help and ask for that preventative care? Yeah,
so I think a big part is you know, family members and friends are a big part of that. They have trust in those family members and friends to begin with, and so I hear oftentimes, I'm here because my wife recommended or something of that nature, and that's okay. That gets the ball rolling, and that allows that relationship to spark. And then once we get that rapport going, then we can start diving down into the patient's true concerns, and we start unraveling some of the stuff that's going on.
Yeah, so what are the biggest risks? You know, if I don't go to the doctor for the next 15 years, what are you concerned about?
Yeah, so there's different age demographics where we have different risks and concerns. As a whole, when we're younger, the bigger concerns are things like mental health as a whole, or early onset of diabetes. And so current diets with lots of fast food and energy drinks and sodas and things of that nature that are so easily and readily available now, those are the big risks early on. So screening for diabetes. And then as we get into our 40s, 50s, 60s, then we start running risk for heart disease and prostate cancer, colon cancer screenings, things of that nature. And then it continues through our geriatric years where we run the risk of being on too many medications or dementia concerns and things of that nature. So it's a continuous evolving process, and so that's why it's important to have that relationship throughout those years.
Yeah, kind of to hit those marks where you can, and also get those important checkups. You know, I mean, those are diseases that can pack a powerful punch when you don't get them checked.
Yeah, having those checkups to make sure that all is well, even if it doesn't necessarily seem like anything is wrong, of course, extremely important. I'm sure we all have somebody in our lives that we can think of that might say, I feel fine. Why would I need to go to the doctor?
Exactly.
When you're talking to somebody like that, getting them to actually change that mindset maybe, is that something that you're able to see happen quite often? And if so, how does that happen?
Yeah, I think a lot of it is reflecting on stories that we have. You know, when we stay ahead of the game, then that's the prevention aspect of it. That results in less medications, and nobody wants to be on any more medications than they need to. So advocating of those early visits keep us away from extra things. Those early visits keep us vaccinated so it doesn't get us into the hospital with pneumonia and things of that nature. So those early steps are that big process.
Yeah, you mentioned you know, chronic diseases like heart disease, diabetes. Let's talk about that. How often are those caught during routine checkups?
So a lot of patients will come in, they haven't seen the doctor in 10, 20 years. It's a common story. And then we get that first routine panel, and it can be pretty overwhelming because you have years of these same habits that have been going on that are building up. And those habits start showing up in blood work suggestive of diabetes, or that risk for heart disease and things of that nature with high cholesterol levels, and a new complaint of some shortness of breath or chest pains where we need some additional workup. So it does happen, and waiting until we're symptomatic oftentimes can be a little too late in the game, and we are forced into more invasive or more expensive therapy as a whole versus the prevention.
Yeah, if I go to a checkup and I all of a sudden see all these things that are wrong with me, that might overwhelm me a little more. So I guess how do you encourage patients to keep coming back to get their routine care?
So our role as providers is education. We can't make a patient take a pill, we can't make a patient eat a certain way, but what we can do is provide the education, make sure that they are involved in their care and they feel comfortable answering the questions. So if we start taking chunks of that and we work through that process together and we make sure that we come up with a plan that works both for them and for us, that's where we get successful medicine. What we don't get success with is when a provider's pushing things on that a patient doesn't feel comfortable with, because then they're never coming back.
Yeah.
Sure. So mental health, of course, being a big part of this conversation as well. How does it work to bring people in for preventative care, their primary care doctor? That might not necessarily be their specialist that they would go to, but that's still a very important part of all of this, I'm sure.
Yeah, so with most annual physical exams, a part of this is also mental screening. And with that, there's questions and concerns that get brought up and some questionnaires that a patient will complete that put us towards a direction of maybe there's some underlying anxiety or some depression and things of that nature. And it's just to be able to spark that. It's not saying that we need to get down into that, because oftentimes that relationship's not there yet with that provider to be able to really dive down into all these feelings that a patient might be having. But it allows us to open that door up and start that process, and then hopefully for future follow-ups, when the patient feels even more comfortable, we can start diving down into those concerns that they haven't wanted to bring up in the past.
Yeah, let's talk about, if I haven't been to the doctor in, let's say, 10 years, how do I even get started? Where do I even start? Do I go to the hospital? Do I go to maybe a local doctor's office? How does that work?
So that's something we also want to be able to provide some education on, because going directly to the ER can provide a lot of burden on the ER. Going to the ER for just a minor sore throat or something of that nature, that's what we want to try to prevent. And instead, getting you over to a primary care doctor such as myself, where we can address some of those concerns and keep you out of those expensive visits in the ER and just the burden of that, so that way they can treat those true emergent situations. So pretty much all clinics, especially Holland Hospital, has options for a patient to be able to establish care. So if you do not have a provider already, you can go on and get scheduled with a provider. And we typically can get you seen pretty promptly. And then depending on your needs, we may need follow-up visits and whatnot, but it can at least get the ball rolling.
Yeah.
Sure. So when people are making these appointments for their primary care doctor, as a provider yourself, how would you say you would navigate around maybe people feeling some judgment or maybe shame around some of that laundry list of things that maybe people get whenever they go to the doctor for the first time in multiple years?
Yeah. So I think those laundry lists can be nice for us providers, because we are trying to address your concerns. And, you set the agenda as a patient in terms of, if it's a concern to you, then it's a concern to us. And we need to start breaking down those concerns and addressing it piece by piece. It may take a couple of visits to be able to do all that if it's been 10 or so years since you were seen, but it's a work in process, and you being involved as the patient helps us get there.
Yeah, is there any, should there ever be any worry for a patient on the financial cost? Some people may stray away from the doctor because they're afraid, it's going to cost too much. What would you say to those people that might be a little apprehensive because of that?
Yeah, so as a whole, ER visits are going to be significantly more expensive than primary care doctor visits at a family medicine doctor office or an urgent care type of situation. And so I think that's part of that information. Another part of that is we have care managers and other assistants that is available for those types of patients. So I don't want that to be a hindrance for them. And being up front with the office and the scheduling can also be imperative, because there are programs out there and resources to be able to make it as financially affordable to those patients as possible. And medications, the same way there. There are multiple medications that we can, as providers, adjust and tailor to that patient to make sure that we're keeping the financial burden as minimal as possible.
Yeah.
All right, so for those who have maybe not been to the doctor in a while, I know that there's been a lot of updates and changes to vaccines and screening guidelines. Can you walk us through some of the biggest updates that have been seen in the past couple of years?
Yeah, so some of the bigger updates, especially on the male side of things, is colon cancer screenings has backed back a little bit. So 50 used to be the magic number, and now 45 is that magic number. Part of that is related to the American diet as a whole, is not necessarily the healthiest diet, but we're catching these early polyps and these early screenings and being able to kind of stay away from the more invasive procedures thereafter. So colon cancer is a big one. Prostate cancer is another big one that we have a lot of resources in now to be able to detect at an earlier age. And at that early age, that's where it's most concerning. And so if we catch it early on, we prevent issues down the road.
Yeah, what you mentioned, those ages are kind of fluctuating just a little bit. Something else too that people want to probably be very in tune to is if your family has a history of a certain illness or disease. What would you say to those folks that do maybe have family members that have some of these chronic diseases we've talked about? And what should they be looking out for, and how early should they be getting into the doctor?
Yeah, so that is that big prompt. And so you have some family history, and so that therefore provides a little bit more urgency to it. We don't just tuck that one away and just ignore that one.
Yeah.
And I would hope that a lot of those patients, they're the ones that have seen a loved one go through it, and they want to make sure that they don't get to that point. And so the earlier discussion with the provider is key with that. It's dependent on the type of cancers or diseases that will therefore result in earlier screening. So the screenings are different depending on what it is that was detected in that family member, but that's that key prompt for that discussion.
Yeah, and of course, where can we find more information if maybe some folks in the Holland area or maybe want to check out the Holland Hospital? Where can people find more information for you guys?
They can go on hollandhospital.org/appointment, and you can go ahead and get scheduled with myself or somebody as well.
All right, we appreciate your time. Thank you so much for coming all the way into Grand Rapids, and really good insight.
Thank you.
Of course, I know it's June and it's Men's Health Month, but of course it's something we all need to be keeping an eye on year round. So
Exactly.
thank you very much.